Thank you, Jean, and thank you to all the panelists for your diverse and insightful perspectives on these matters. Now we'll be moving on to a very short panel discussion in the interest of time. I have one question to start the discussion off. As we've heard throughout these town halls, people have had vastly different experiences learning about PFAS, seeking testing, medical advice, and care. Are there any factors you would recommend to NAS to take into consideration in developing their guidance to help make PFAS related to healthcare more equitable? For example, we've heard about perspectives from rural communities and indigenous communities and occupational exposures.
This is Jean. In my community, it would be really helpful to provide information in Spanish.
Yeah, and I mentioned this a little bit. The community health aides are really the heart and soul of the healthcare system here, particularly in rural Alaska. So in addition to educating physicians and nurses, it's very important to make sure that the community health aid program is included in that. And then I would just add additionally that so much science has come about since the C8 studies, and I think it's really necessary to synthesize that in a way that healthcare providers can use that both in a clinical setting, but also in policy advocacy.
I would just add from the occupational perspective.
Thank you.
Yeah, from an occupational perspective, the Department of Defense's commissioned work test 10,000 of their firefighters. So it'd be nice for consideration, not just for firefighters, but anybody that's exposed within industries that are using PFAS from the occupational side would be worthy of consideration as well.
Absolutely. Thank you. Kevin?
Yeah, thank you. And thanks to all the speakers. I really appreciated what you had to share. It was very helpful. This is a question maybe specifically for Randy, but I'd love to hear any thoughts from Jean and Pam as well. You know, you showed your testing results, Randy, which was really interesting. And I was curious to get more of your thoughts on sort of in what ways that testing has already been helpful for you or your fellow firefighters, or in what ways it hasn't. Say, even if, you noted you're hoping that we can provide further input on possible health effects, but to the extent that you're not sure about possible health effects, could you tell us a little bit about the ways in which just having that sense of where your results fall compared to NHANES and so on has or hasn't been helpful, if it's affected your behaviors or other firefighters, just trying to get a sense of the utility of those kinds of tests?
That's a great question, Kevin. I remember when we commissioned the testing and we had it all volunteer and it was anonymous. So I only know my test results. I don't know each of my individual firefighters' test results. And then I had a conversation with the team that did the testing before we communicated with the entire fire department, not only my fire department, but also there were 7 departments that were involved in the testing. Portland Airport was one, and just for this group, Anchorage International Airport, Chief Jesse Davis had some of his firefighters tested as well. So it's not, we didn't want to create a panic because we don't know what we don't know. So we're going to give them this results, and then what are they going to do with them? So we were pretty strategic I didn't know my results at this time. And we had a generic letter that was created. And you see as the graphics, it's very self-explanatory, very simple. I call it Randy proof, so I can even understand my data as it compares and relates to other sets of data. I don't know the dynamics of each of those components whatsoever. But we ended up getting the information to them because we wanted it in their hands. And we gave it to them with the premise that we'll follow up with Dr. Burgess. We had meetings with each of the shifts to communicate what the data, what it may mean, and that there's really there's no health indicators yet. And that's what we're mining that data. We're like first to the market, right? So we're creating a set of data points early so that they can test it over a period of time. And as new information comes about, and as you guys learn and maybe solve the mystery to some of this stuff, then we'll be able to communicate back. And I actually talked to Dr. Burgess this morning, And it was interesting that he said he wants to retest so that he can create in this 30-year period, so he can create, is it better, is it worse, and what's happening over an evolution. But in the end, we don't know. I personally don't know what to do with it. I make sure I'm healthy. I'm fitter than I've ever been today at 58, and I want to maintain that. But what this does provide me is that if things start to deteriorate at some point in time, at least I have that information, and maybe that's not the link, or maybe it is, but we have information available to us.
Thanks.
Jean, do you have anything to add? It looks like we're at time for the discussion, so I'll turn it back to you, Ned. Thank you, everyone.
Thanks so much, Anna. And I also want to thank each one of the presenters. I think these perspectives are useful, very useful, to us. And, seeing the wide-ranging impact on communities across the country has been very important for the committee to take under consideration.